Hello, everybody. I know we're running a little bit behind today, but we are here because sometimes there's a little bit of technical difficulties, but we figured it out and we are ready to go. So, what I want to know is I know that you guys are watching, but I never know who is watching until you chime in and you let me know. So let me know who's watching so that way I can say hello to you because I want to make sure that I acknowledge you. And you guys always know that I want to know about the weather. I just always curious about how it is in other places because we went to North Carolina for the holidays for Thanksgiving and it was cold. And I didn't really appreciate Savannah weather until we got back. And I was like, oh, I think I do like it a little bit warmer. So I just wanted to know kind of who's watching. I'll let you guys have a few minutes to kind of chime in. That way I can make sure that I get a chance to say hi. And then we will get started because what we're talking about today is really important. And it's one of those things where I decided to say we have to get comfortable talking about uncomfortable things. And the way to do it is to just figure out how do I approach these situations. So I want to make sure that we are able to do that and know how to do it. Sometimes it's not necessarily the issue itself and doing the uncomfortable things. It's I don't want to do it because I don't know how to do it. I don't know how to approach it. So today what we're going to really talk about is that uncomfortable thing that we really don't want to talk about, but we're also going to talk about how to have that conversation. Because I'm running a little bit behind, I'm going to go ahead and get started because I want to make sure that I don't take too much of your time today. But like I said, I'm excited because you guys know with lessons from Beyond the Stethoscope, our whole job and the whole purpose of this is to provide you with some real world behind the scenes medical information so that you can be able to make some more informed decisions, because what we understand is that there are a lot of things that happen in your life, and those things that happen in your life, they ultimately are going to affect your health. I see a lot of times where things are going on in people's lives, and once those things either settle down or whatever, then their health starts to get under control. So if we can be able to navigate the healthcare system, navigate your life, then we can then start to see those changes and be able to experience this whole great life that you guys want to enjoy. So welcome to episode 5. And this is part 1 where we are doing the chief complaint and common culprits, and it's of obesity and its common causes. And I am here today with Dr. Kimberly Bibb. She decided to join me on today. And Dr. Bibb is someone that I met when I did my residency at the University of Mississippi Medical Center, or UMMC, in Jackson, Mississippi. She was actually one of my attendings. And one of the things that I really appreciated of Dr. Bibb was just, how there's some people that you meet and you just watch them and you see how they interact with others and you see their kindness and their gentleness. But along with that, and her great bedside manner, like very knowledgeable and had the information that will make the most sense for her patients. So with that, I also hold on, guys. See, I'm at work and I'm getting a phone call. So give me 1 second. Let me make sure that we don't get interrupted. I forgot to kind of silence that for us. Okay. But with Dr. Bibb, like I said, and then what happened is some of her patients, I would see them because she wasn't in clinic, or sometimes they'll put them on my schedule, whatever. Then the patients would say, "Oh, yeah, Dr. Bibb." And I was like, "I'm not Dr. Bibb." And they would say, "Oh, yeah, that's right. You're not Dr. Bibb, but you remind me so much of Dr. Bibb." And I would like take that as such a huge compliment because this is someone that I looked up to and someone that I knew, like just gave so much of herself to her patients. So I'm just like honored that she decided to come with us and talk with us today. So I'll give you guys a little bit of information about Dr. Bibb. She, um, she is a board certified family medicine physician and also an obesity medicine specialist and an associate professor at UMMC in Jackson, Mississippi. She went to Tougaloo College, and that's where she obtained her BS in biology. And after that, she went to the University of UMC UMMC for her medical degree. And after she completed her medical school, she went and did family medicine residency at UAB in Huntsville, Alabama. She returned to UMMC, and now she is family medicine, and she's doing what family medicine do, treating children and adults and people of all ages, doing acute and chronic care. But the other thing and the other piece of why she's joining us today is that she was an integral part of starting their obesity medicine clinic that they have, their weight medicine clinic, and that is where they focus on healthy lifestyles for their patients, but also treatment and preventative measures as well. She lives in Clinton, Mississippi with her husband and her two daughters. And in her spare time, she enjoys traveling and just spending time with her family. So thank you so much for joining us today, Dr. Bibb.
Yes, well, thank you very much, Dr. Booth, for that wonderful introduction. And thank you for having me on your show today. I really appreciate it. It's such an honor. And I'll just say real quick, you mentioned how you watched me, and we just never know when people are watching us. And so I appreciate those kind comments. And again, it's an honor to be here, and I'm looking forward to our discussion today. So thank you.
Thank you. So, guys, we're going to get into it. One of the things is what I realized is that obesity is a sticky subject for people, because if we just think about it in society, people who are overweight, we are not kind to them a lot of
Mhm.
times. There
Right.
are jokes, there are comments, there are lots of things that happen. And so patients take that with them into the doctor's office. Am I going to be judged? Are they going to say something to me and be rude or be mean to me and that sort of thing? So even if we're trying to approach this topic and we're trying to be nice about it, depending on what we say, and we may not even try to be mean, we're just, just kind of saying what needs to be said. But even with that, people can have a defense mechanism against it and kind of get upset about it. And one of the things that noticed is that patients dread getting on the scale. Like today, I had a
Mhm.
patient that came in and she said, I said, okay, we're going to have to go ahead and get you on the scale, get your weight. She was like, what? And after Thanksgiving? Like, what are we doing? And I was like, this is what we have to do. And she was like, okay, I'll do it. But it's not that we're trying to be nosy. Honestly, we need this information. And there's several reasons why. One, it could just be you have medications that you are on, and we
Mhm.
need to make sure that you are on the right dose because they can be based on your weight. The other
Mhm.
thing could also be prevention. We want to make sure that if you're starting to get closer and closer to a certain point, then we need to start taking some measures so that we can make sure that you don't succumb to some of these other diseases. The other thing is, whether we like it or not, insurance can dictate certain things for us, and one of those things sometimes is weight. They say you guys need to have this information submitted, we need to know this information, or we are not going to count this as an appropriate visit. So I know sometimes I have patients get really mad at me and they say, well, I'm here for an earache. What does my earache have to do with you taking my weight? And why do we have to talk about it? Because I know I had some patients that I wouldn't do it all the time. I at least get the weight, but I may not address it at that visit. We'll talk about it another time because I know you don't
Mhm.
feel well. You're not trying to talk about that right now, so we can talk about it later. I've had patients come to me and they said, I went to this other doctor and I went for this one problem, but all they would focus on was my weight. I didn't even want to talk about that day. So I can understand the frustration.
Right.
So knowing all of this, Dr. Bibb, like how do you approach that with your patients, and how do you feel like we should start having these conversations with each other?
Yes, and I totally agree with everything that you indicated there. And you're certainly right that there is so much stigma and bias and even discrimination towards people that are overweight and obese. And so, even like before going into the patient room and just even having discussions with my residents, my medical students, and even my colleagues about how we can eliminate some of the stigma around obesity. And so, one of the things that I have started doing is having more talks and lectures around this particular topic, because for one, we don't get a lot of this training when
Mm,
we are in medical school and in residency. And so, that's been one of my primary goals, is to increase the education around that. But in terms of seeing my patients in the office, as you mentioned, this can be a very sensitive topic. And a lot of times patients do not want to even discuss their weight or anything related to their weight. And so, a lot of times I'm talking with my patient, and then kind of towards the end, I'll say, so, how are you doing with your diet and exercise? And they're like, oh man, I knew you were going to ask me about that. And so, but really, truthfully, I first, just ask permission. Is it
mm,
okay if we have this discussion about your weight, and allow the patient, to give me permission to even discuss their weight. The other thing is to approach it in a very respectful and non-judgmental manner. So one, just not blaming the patient or the person for the weight that they are at that particular time.
mhm,
Because as we'll talk about, there are a lot of many different factors that can contribute to weight. And so one thing is to not blame the person, and to make them feel comfortable in talking about their weight. The other thing is to really explain to them how their weight can affect their overall health, and the other complications that can be a result of their weight. And so I think a lot of times when they are more informed and have a better understanding about how their weight can affect their overall health, then that allows us to have a better discussion about it. And again, just helping them to feel comfortable in that environment, and that we're not judging them, and just being respectful towards them. I think those are some of the most important things. Another thing I will say is, a lot of times patients are referred to me, and they may be coming just because a doctor referred them, but they
mm,
may not really want to be there. So, I will have to assess what is their willingness and readiness to make changes at that time. And so if they're not ready, then I have to take a step back and reassess and kind of meet
mm.
them where they are. And then, we'll say, well, we'll talk about something else, or, we'll regroup and come back at another time when you are ready. But we may talk about a few things that we can do in the meantime, and then maybe explore some of those reasons as to why they may not be particularly ready to make changes. And so, again, it's just really having an open dialogue and helping the patients to feel comfortable in those settings.
That's really good. I like that point of asking permission, because
Mhm.
I think that really starts to open people up. So instead of just jumping right into it, okay, I see this, blah, 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 this is what we're going to do. But are you okay? Like, can I talk to you about
Mhm.
this? And that's a really
Right.
good point. And like, I think something else I'm going to add to my two bag, because I think I kind of roundabout asked, but not really.
Mhm.
Sometimes I was like, okay, we need to talk about X or whatever, but that's a really good one. Just asking permission. Can we talk about this? And then if they're like, no, then we revisit it later. Okay, I see that we don't want to talk about it today. That's fine, but we may revisit it in the future. But respecting them and their boundaries on it, I think is
Mhm.
key. I like that. So since we're talking about obesity, exactly what is it? How do we measure it? How do we get to this place to say, okay, you are at this level and this is what obesity is, blah, blah, blah. How do we just even get to that point? What is it?
Yeah. Again, that's a very good question. And believe it or not, many people don't realize that obesity is an actual disease. Um, and so the American Medical Association, which is one of the largest organizations for physicians, defined obesity and considered it as an actual disease several years ago. And so a disease basically has various characteristic signs and symptoms. But obesity in and of itself is a very complex and complicated disease that can be due to various different factors, a whole lot of different factors. But really, in a nutshell, it's really when we have an imbalance between the energy or the food that's taken in versus the energy that's expended. So when you have an imbalance and you have the increase or the food or energy that's taken in exceeds the energy expenditure, then that's what leads to obesity in general. And so we can measure obesity in various ways. One of the main ways that we measure obesity is with what's called the body mass index, or the BMI. And so that's a very simple way for us to measure obesity. And so it's a measurement of one's weight based on their height. And so, and we probably have seen these BMI charts. And so it defines what a normal weight or healthy weight is versus being underweight, and then overweight, and then in the category of obesity. And so that's one of the main measures that we use to define obesity. Another measure or some other measures that can be used are the waist circumference, also body fat percentage. Those are some other measurements that can also be used to assess a patient in terms of being obese. I will also state that obesity, because it is a very prevalent disease here in the US and across the world, it's really the most prevalent chronic disease that we have. And as of 2020, the rate of obesity among adults was around 42%. If we look at the charts that they each year or every year through the CDC, we can see where over the years, more of a reason why it's important for a treat. It leads to a lot of various complications that can result in premature or early death for a lot of people. And we can talk about some of those complications, but because of some of those complications that can certainly be prevented, like diabetes, heart disease, high cholesterol, even various types of cancers that are associated with obesity. This is even more of a reason why we should have discussions with our patients about it, and again, develop appropriate treatment plans for them to appropriately treat it.
Okay. That, and I think people don't understand really how serious this can get, like you said, like the premature deaths from all these different diseases and those sorts of things. But when we're thinking about it, some of these things, like you said, you talked about the BMI and the energy in and energy out and that sort of thing. But what are some other like common causes? Like, are there some things such as like medications? Can certain medicines cause obesity?
Yes, yes, yes. You're certainly right about that. And believe it or not, some of the medications that we use to treat some of the complications, like some of the medications we use to treat
Mm.
diabetes and hypertension and depression, they can actually lead to weight gain or increased weight in patients. And so, in particular, for instance, with high blood pressure, the class of beta blockers is
Mm.
known to cause increased weight in patients. For diabetes, some of the medications that we use, especially some of the older medications in a class called sulfonylureas, some of these medications include glipizide or glyburide or glimepiride. Those are commonly known to weight gain as well. There are a couple of other medications for diabetes, such as Actos or Avandia, that can also lead to weight gain. Um, some of the, as I mentioned, antidepressants. One of the classes that we use a lot is called SSRIs. And some of the medications in this particular class are sertraline, paroxetine. Those are at least two of the more common ones that we see that can cause weight gain in patients. Prednisone is another medication, especially patients that are on long-term prednisone use, that can be associated with weight gain as well. And so when we are evaluating patients, it's very important to take a look at their medications and determine if any of those medications can be contributing. And then if so, see if we can use some alternate medications that could not promote weight gain and maybe even lead to some weight loss with patients, because there are especially medications that are used to treat diabetes that can be used to help patients in terms of losing weight. And so a lot of times, when I see patients in weight management, I'm seeing patients that are referred to me from their primary care physician or from other specialists. And many times I don't change their medications, but I'll just make recommendations that they can discuss, possibly having some of their medications changed, or even what's even better than that is really to send a note to the referring provider and let them know what my recommendations are in terms of potential medications causing or contributing to the patient's weight, and then ask if possibly any changes could be made in terms of that. And so we do try to collaborate with specialists and primary care physicians in terms of trying to optimize the patient's medication regimen to hopefully not have that to be a factor in their weight gain.
That's a really good point. Now, along with that, I want to tell people, because I like that you said that when they come to you from their provider, then you make those recommendations and say, see if these are some adjustments that can be made. So I want to make sure that we're clear to the patient to know, even if you're not seeing an obesity specialist and you're talking to your primary care doctor, don't just automatically start saying, oh, she said SSRIs, she said glipizide, she said all these different medicines, and I'm on that. So I need
Right.
to stop this medicine because it must be causing me to gain weight. So we are not saying that. What she's
Right.
saying is that you need to talk to your provider about it so that they can think about it. Are there other alternatives? Sometimes, depending on your medication regimen, depending on like your lifestyle, all that kind of stuff, some things can be changed, some things cannot.
Right.
So that's the other thing. So because of all the things that we know and all the different factors, then we
Yes.
want to make sure that you talk that out with your provider, the person who prescribed it. Then you go and talk to them and say, do you think this could be causing it or whatever? Now, if your weight, let's talk about this. This is something interesting. If their weight has remained stable, let's say that they were already had a higher BMI. So that means that they were already having issues with obesity, and they were started on a medicine, but their weight has pretty much remained stable since they've been on that medicine. Is that something that they need to say, well, I still need to come off of it because it can cause weight gain? What are your thoughts on that?
Right. And so, if their weight has remained stable, then it may not be the medication.
Hmm.
And as you mentioned, because there are so many various factors, and generally it's not just like one or two things that causes obesity or a patient being overweight. Generally it's a multifactorial disease, and it's caused by various different factors. And so especially if a patient's weight has remained stable, then it possibly, more than likely, is not the medication that may be contributing if their weight hasn't really changed as a result. So in that case, I probably would not recommend that there would be any changes made in that particular case. And so again, just then going back and discussing in more detail and looking at other things that could be contributing. As I mentioned, looking at diet, um,
Hmm.
really in detail, even to the point possibly seeing a nutritionist. And I know we'll talk a lot more about diet and nutrition in our second session, but many times diet plays a big factor in our weight, along with lack of or inadequate physical activity. And so, a lot of times I say to patients, well, let's try to make sure we're doing our as much as we can, in terms of improving our diet, eating a healthy diet, and trying to increase our physical activity, at least to the recommendations that are recommended for all Americans, and try to work on those things, and then, see if we can make adjustment or make changes in our weight. And more than likely, usually we can improve weight just by focusing on those things alone.
Okay, great. That
Mhm.
that was the only reason why I wanted to make sure that we clarify, because I know
Yes.
sometimes people will take it and they say, "Oh, I saw this thing, and there was two doctors that were talking, and they said," So I just want to make sure, even if you heard what she said, and there might need some adjustments or some changes, just make sure you talk to someone before you do that. But
Yes.
speaking of the causes, the other causes, we talked about medication. What about thyroid? Because I know a lot of people talk about,
Mhm.
it could be my thyroid or whatever.
Yes.
What are your thoughts on that?
Yes, glad you mentioned that because thyroid, especially what's called an underactive thyroid or hypothyroidism, or having too low of the thyroid hormone in your system, can definitely lead to weight gain. And so that's really one of the main things that we screen for when we are evaluating patients. And I tell, my residents, especially before they even decide to refer a patient for weight management, then to make sure that they are assessing the thyroid status and seeing if that could definitely be a cause of the patient's weight. Because I have definitely seen where patients that have not been diagnosed before, and we, find that they have hypothyroidism, that
Mm,
it can definitely contribute to their weight. And then when we get them on the appropriate dose of the thyroid hormone, then a lot of times their weight will decrease as a result of getting the thyroid levels under control. And the same thing if a patient already has been diagnosed with a thyroid condition and they are on medication, it's very important for them to continue to have their levels monitored, to see if any adjustments need to be made, to see if that could possibly, again, be contributing
mm,
to their weight if they're starting to have weight issues, even after they've been diagnosed with a thyroid condition. So the thyroid is one of the main things that we assess for when we are evaluating patients for weight gain. So you're very right
okay.
about that. Hmm.
That's good because, especially those who have the thyroid issue, like before you're diagnosed, and then checking if that's an issue. But then those who have been diagnosed with
Hmm.
it, I have noticed they say, I feel a little off. My energy's off, and sometimes that it'll present that way, like my
Right.
energy's off. I'm not able to be as active as I want
Hmm.
to be. Those
Hmm.
sorts of things, and then that then starts to lead to the weight gain too,
Hmm.
because they're not doing all the things. So that's a really good point to talk about thyroid. And thinking of that, the other thing I'm thinking of is like mood and patients and how they feel, that sort of thing. How does that affect weight?
Yes, mood and how patients feel can have a very significant impact on their weight. There are a few conditions like depression or
Mm,
even seasonal affective disorder, which can cause patients to just feel down and depressed, and just not wanting to do anything, just not having any energy to do anything. And so, again, just lack of physical activity. And then also, some of those conditions can be associated with overeating. Or
mm,
eating or having various cravings for unhealthy foods. And so, all of those things, as it relates to how a patient feels, can be associated with increased weight over time as well. And so, again, that's one of the things that I evaluate for when I am first seeing a patient for weight management. I actually have a questionnaire that they go through, and we have questions related to their mood and how they're feeling, just in general, and about their weight. And so, if I identify that there are some concerns related to their mood, or if they even have a history of depression, I will kind of dive into that a little bit more in detail. And, a lot of times they'll say, well, I came to talk about my weight. I'm not here to talk about my mood or depression. And I say, well, all of this works together. And
Mhm.
so we really, before we can get into assessing your weight or addressing your weight and coming up with a good weight management plan, we have to make sure, your depression is under control, and because that can affect, how you're eating, and how much physical activity you're getting in. And so, a lot of times I'll have discussions with my patients, even in the weight management clinic, about their mood. And then, if appropriate, I may even refer them to a behavioral health therapist, or
Mm.
to psychology or psychiatry, if appropriate, to help with those conditions that may be affecting their weight as well. We even have what's called binge eating disorder, which kind of falls
Mm.
in the psychiatric realm, and that can also play a role in how patients eat, because a lot of times with that, patients will tend to overeat or eat large amounts of food at one particular time. And so again, that can be associated with how their mood is in general. And so mood again can have a very significant
Mm.
impact on how patients feel, and their relationship, with food, and even just some of the other activities that they, could be potentially involved in, if their mood and depression, and other conditions like that were appropriately treated. So again, it's very important. And I have those discussions with my patients all the time. And again, that's another sensitive topic, but one that's very important, and one that we have to have. And so,
Mhm.
just really, again, trying to help patients to understand that, and helping them to feel comfortable with having those discussions, I think is really the key, in terms of having better discussions with them about it.
And it's very the other. I like how you mentioned and you said that they don't want to talk about some of those issues and say, "Oh, I'm just here about my weight." But I
Hmm.
like that you say this is it could be due to a lot of different things.
Hmm.
And we have to address and talk about it, because if we just focus on the weight and just say, oh, maybe it's just diet, or maybe, some people just say, oh, well, I just want to take this medicine and get the weight off. But if we address the real root cause of it and let's try to figure it out,
Right.
then we can kind of help that along the way. So I really like that you take this practical approach, because the other thing that I know is sleep, and
Yes.
sleep can affect it, but people are like, "I'm not here to talk about sleep. Like,
Right.
what does sleep have to do with this?"
Right.
So, because I know I've mentioned it a few times with my patients, like, "How much are you sleeping?" This and that. So, in your experience, talk to us about sleep and how that affects people and obesity.
Right, right. Yes, as you mentioned, again, sleep plays a big role in the regulation of weight. There are various hormones that are associated with sleep, and that can also affect our weight. And even, when people don't get adequate sleep, they tend to crave a lot of different types
Mm,
of, again, unhealthy food. They have more cravings for more fatty food and sweet food, and so, again, those things are reasons why getting an appropriate amount of sleep is very important, in terms of weight. And so, as I mentioned, again, hormones, there are a lot of different hormones that are associated with the weight process. And again, these are factored in, when we sleep as well. And so those are very important reasons why it's important to get an adequate amount of sleep. One of the things that we also, look at is sleep apnea, because that can be a very significant complication of being overweight or obese. And so many times or really all the time, we assess patients for sleep apnea, because again, if they have sleep apnea, they're not getting the proper amount of sleep, the restful sleep that their body needs. And again, that can be a big factor in a patient's weight as well. And so, as you mentioned, not until we assess some of those root causes will we be able to identify what may be contributing, to a patient's weight gain or being obese. And so again, we have to really explain. I think, when I explain to patients why we are asking certain questions, why we are doing certain things, then, they have a better understanding as to how all of that, plays into their overall health. And I think when we have those discussions, then it helps patients be more informed, and they can be better partners and take a more proactive approach to being involved in their own overall health. And so I think, it's good to have those discussions. But that's really why sleep and how sleep can affect a patient's weight and have some potential effects on their weight if they're not getting an adequate amount of sleep.
Okay. Well, I have a couple of things on that. One, I felt, as people say, attacked when you talked about if you don't get enough sleep, then you start craving the things you're not supposed to have. And I said,
Uh-huh.
oh, she's talking about me. I will grab some of the things I know I'm not supposed to have, but
Uh-huh.
now that I know, I will take heed to what you just said. So I will do better. Maybe that's the sign that says I just need to go to bed. So I will make that correction. Thank you.
Yeah, believe
The
me,
other
I did the same thing. So talking to myself as well, Ashley, Dr. Booth.
I know it's the see. I mean, it's normal life. That's what we
Yes.
do. But
Yes.
knowing the information, and it's like what you said earlier. Now that we know, now I
Right.
can be more proactive, and I can think about, okay, she said that when I'm not getting the sleep and I'm staying up and I'm doing the things, that this is one of the reasons why I'm grabbing something that is probably not the best thing that I should have, especially at this hour because it's usually late.
Right.
So I appreciate that, but I also like the point that you are explaining to your patients, and that's one of the things
Hmm.
the reason why this platform is here is to explain and to get the information out. Because what I also understand is that we have maybe 15 minutes. That's the typical office visit, 15
Hmm.
minutes. And of that 15 minutes, you may only have about 5 or 10 with the actual doctor that you
Hmm.
see. So this is a lot of information that we have to explain and get out and talk to you about so
Right.
that you can understand. And we don't get a chance to get this information out as well as we would like.
Right.
So now that I like the fact that you are okay, we're asking these questions. It might feel uncomfortable answering these questions on this questionnaire, but the reason why we're doing it is because of this. And so once
Right.
people say, "Oh, okay," so they're doing it. They're not trying to be judgy. They're not trying to get in my
Hmm.
business. It's
Hmm.
because this is important. And then now we're going to use this information to do this. And then
Right.
once they understand that process, then they say, "Oh, okay, well, now I know I'm not just taking this medicine because she said I need to take it. I'm taking this medicine because it's going to do blah, blah, blah. Or I'm changing my habits because of blah, blah, blah. And now I know how to do it." So I think that's really great. And I love that whole approach with the patient is involved with their care. But
Hmm.
with all of this, I know we talked a lot about the causes and things like that. Were there any other things that you would like to mention? I know we're going to come back with a part two, which I'm excited about. But today, just focusing on what is it and what could cause it. Are there any other things that you would like to discuss that we didn't really touch on or that you want to talk a little bit more about?
Well, I guess I will just say that, I realize again that we have certainly discussed a lot. And as I mentioned before, obesity and managing obesity is very complex and complicated, And so, what I really try to, explain to my patients, because again, when they come in and we're talking about all of this, and at the end, I can kind of tell that they feel, or they seem to be kind of overwhelmed with a lot of information that I'm providing or that we're discussing, and so what I try to do is tell them, you know don't feel too overwhelmed by what we're discussing. I know it's a lot, but I'm going to work with you. We're going to take one step at a time, and so helping patients to realize that it's a process, that it's not going to happen overnight. I think a lot of times patients will, and I think we mentioned this at one point earlier, come in looking for a quick fix, having just one magic pill that will just take their weight away, and that we won't have to do anything else. But again, realizing that this is a journey, it's going to take time to make changes, and it's hard to change your habits, and so again, a lot of times I'll incorporate behavioral health coaches or psychologists to help us with the process, or nutritionists as well, or even exercise physiologists to help us with the process. But just realizing that it takes time, and that I just want to encourage people to just continue with their journey, and not get too discouraged by it. Just keep working towards your goal. Try to set small, realistic goals that you can achieve. And once you achieve one particular goal, then you can set another goal. And so I think a lot of times too, patients may get, as I mentioned, too overwhelmed, and just wanting to do a whole lot at one time. Like, I'm going to lose 100 pounds, in a few months, or 50 pounds, but again, thinking about what's realistic, and that's achievable and attainable will be a better approach for patients. And so again, helping patients to look at it like that, I think is very important. And so I know, as we go through the holidays, as we are getting ready for the Christmas holiday season, we may have a lot of parties and things that we're going to, but again, just trying to again set some realistic goals that you can try to attain, in terms of trying to eat a healthy diet, exercising on a regular basis, getting an adequate amount of sleep. And I'm just looking forward to our next session, when we can kind of go more into some of the treatment strategies for treating overweight and obesity for our audience. So that's, I think, all I would have for right now.
Thank you. That I think that approach is really good, because you're right. Like, slow and steady, as they say, wins the race. And I
Mhm,
tell a lot of patients, you didn't put this weight on overnight, so let's not
mhm,
expect to lose it overnight. And like you said,
mhm,
there is a part two that's coming, so you guys stay tuned, because we are going to approach like treatments, because everybody's talking about Ozempic. So you guys are going to have to sit until on the edge of your seat until we come back and discuss that. And because that is like the magic pill right now. I actually had a drug rep come by my office today, and she said, I don't have any samples. And I've been hearing that a lot around town and stuff, with other doctors and stuff, either getting samples or just getting the medication to their
mhm,
patients. And she said they're routing the samples to the pharmacy to
mhm.
help with that shortage that we
Yeah.
have going on, because Ozempic is the big thing right now for weight
Yes.
loss. I've had patients who do not want to take a pill, but they want that
No,
Ozempic, which is an injectable. So
it's
we are going
right.
to talk about that and some more. But right now, as you go into the holidays, just like she said, just keep your goals that you have in mind, your realistic goals, because we're going to come back in January and we're going to check in with you guys to see how things went and how to keep you on track, because we know that that's your reset button. Everybody tries to do the reset in January. We're going to make our New Year's resolutions. We're going to do the things. But in order to stay on track with them, how do we do that? So I just wanted to make sure that you guys are informed and know what's going on. So thank you, Dr. Bibb, so much. I was about to call you Dr. Booth. See, like the patients, and they flip us around all the time. Uh, but thank you so much for joining us on today. I really appreciate it, and you taking the time out of your schedule to do that for us.
Yes. Well, thank you so much for having me. I appreciate the work that you're doing, and I appreciate the invitation. I have really enjoyed discussing this topic today, and I'm looking forward to our next one. So thank you as well. I really appreciate it.
Sure, thank you. And thank you guys for joining. Patricia, I did see you hop on and you said hello. So, hi, Pat. I really appreciate you tuning in. And I know there's some others that are there that probably didn't say anything, but it's totally okay. I really appreciate you guys like tuning in and watching and keeping up with everything that's going on. Be sure that if you enjoy this and it makes sense to you and some other people can benefit, send it out, share it, let them know. If you have questions, because Dr. Bibb covered quite a few things on here, and you say, "Oh, I was wondering about blah blah blah." Send me a message. I can pass it along to her. We can do like a follow up and get your questions answered. The other thing is, if it makes sense to do it in the next session, and we want to just answer a few of those quick questions, we can do that as well.
Right.
But the whole purpose of this is to get information out to keep you informed and make sure that you are well. So until next time, I will see you guys soon. Take care.